fine lines here around my mouth, you know, these lines, fine lines, and I've never smoked or anything, but fine lines around my mouth. My skin's basically pretty good shape, but, you know, no acne or anything like that, scars, but I have a little sun damage and a little fine lines around here and my mouth and on my chest, so that's what I'm hoping to improve.
All right, here we go. 1, 2, 3. Fractionated CO2 is the procedure. Okay, there's lots of different lasers out there that do fractionated CO2. More medicine? Need us to wait a few minutes? Just tightens right up. Rather than burning off the whole face, we're now just doing a fraction of the face. They've developed a scanner that rather than the whole thing, it punches very small little thermal dots in the skin. So visually, if you can imagine, it's like aerating a yard. You know how it takes all those little plugs out. That's kind of what's happening with the CO2, except it's vaporizing that tissue, so it's tightening at the same time. The tissue is tightened, the skin is tightened, but you've still had a thermal injury. So your body is like, okay, what happened? We don't know, but we got to send in collagen. We got to repair it. So all of a sudden you got all this new collagen coming into your skin to repair it. And that's why when we do now the fractionated CO2, we see it a 10% tightening right on the field. I mean, I don't know if we got close enough where you could actually see Leslie's skin tightening, but it does, about 10%. But then over a period of the next 2 months to 3 months is when you see an amazing result, because you get another 10 to 15% of tightening. Depending on the practitioner, depending on how aggressive you are, it is a dangerous procedure. The person that's doing it needs to know what they're doing. It needs to be controlled. It's not something you experiment with, but it's amazing if done in the right way. The fractionated CO2, or the DOT, in our case, the laser we use, it's a very effective for treatment for tightening and doing all those things. Now, the one thing it doesn't do is treat anything vascular. It doesn't treat anything red. You can't use it for red vascular lesions, but it gets rid of hyperpigmentation, and it tightens. That's the most important thing that the fractionated CO2 does, is it tightens. It's an option that we have available now that we didn't have 5 years ago. It's going to prevent, if people can get in and do these treatments proactively when they're younger and before they get a lot of looseness and loss of elasticity in the skin, if they can get in and keep their skin nice and tight with their fractionated CO2, it will eliminate a lot of surgeries, which is what we love. In my field, we love surgery and we love making people look better. But the trend is going toward less and less invasive stuff. And this is an amazing option for what's happening in today's market.